even though you're not going to believe it right now, you're not broken, you're not crazy, and there's nothing wrong with you. If there is that feeling there of wanting things to be better, they can be better. And to be curious about that and follow those breadcrumbs, whether it is reaching out to someone in your life, journaling, seeking that support, following my stuff if it supports that feeling you have, you get to notice that and trust that. You don't have to keep pushing that away anymore.
Welcome back to the We Don't Know Yet podcast. Today is the first guest interview of 2025, and Zeb and I were lucky enough to sit down with Monique Beaver. Monique is a registered psychologist, a trauma-sensitive yoga facilitator, and the owner of Mindfully Curious. In this episode, we touched on topics such as trauma, PTSD, and CPTSD, as well as how the two differ, and how somatic-based therapy might be beneficial for people experiencing these conditions, as well as what that actually looks like. As a disclaimer, this episode does touch on topics such as trauma, mental health, and experiences that might influence or lead to these conditions. If you like today's episode, so that we can continue bringing more conversations like these to you, it would mean the world to Zeb and I if you could hit that subscribe button on whatever platform you're listening to and give us a rating for the episode as well. Without further ado, let's dive in.
Whilst both Maddie and I are healthcare practitioners, we understand that there's no one-size-fits-all approach to healthcare. Should you require any medical attention, please seek out your local healthcare practitioner.
We'd like to take a break from today's episode to give a quick shout out to our sponsors, Drip Digital. They manage all of our audio and video editing as well as our social media marketing. Without them, the We Don't Know Yet podcast wouldn't be possible. So thank you again. First guest of 2025. How exciting.
Yeah, very exciting. We've finally mastered our new podcast studio space too, which is nice. So welcome, Monique.
Thank you.
To the podcast studio, the Great Creative Studio for 2025.
Very, very good.
Yes. And how was your break?
It was good. We had Christmases and birthdays, my birthday and my son's
Happy
first
birthday.
Happy birthday. So all of the things.
Yeah.
So all spectrums, all ends of the emotions, and but it was really lovely to just have some family time, and we're now back and reconfiguring all the different parts of life again.
Yeah, that's it. And we were saying before we were trying to coordinate this last week, we were saying how hard it is to get going for 2025.
Yes.
And like we got back from Melbourne on the Saturday and I was like, oh my God, what is going on? We have a podcast to film on the Monday, but here we are this week.
Yeah, we've got it. Yeah. We've got our ducks in a row and we're ready.
Yes. Well, I'm very excited for this episode. I think I'd heard your name being thrown around a little bit, and obviously working in the area too. I'd heard your name be passed around the health professional
good
kind
ways,
of network.
Of course. Good ways.
Yeah, very good things. Very good things. Yeah, we should preface with that first.
I'll take it.
But yeah, I think we've been trying to tee this one up for a while. Hey.
Yeah. I will own that one.
No.
How dare you have a baby?
Yeah, what? You want to have a baby?
Goodness.
Yeah, I know. When I got here this morning, I was like, I'm pretty sure this has been building up for like a year now. So it's so nice to finally land here. Obviously I was on maternity leave last year and came back towards the back end of last year, and now this year building it all back up again. And it's I was saying to you guys before how lovely it is to actually get out of the house and land in an actual studio as opposed to Zooms and just being in my living room.
It's got a different touch, doesn't it? You know, sometimes the podcast in person. We always say how like we really enjoy the in-person podcast because you get to catch up before, you have a coffee, you take some cringe photos, you know.
Absolutely.
I feel like everyone's moving away from the Zoom and online space as well. Like obviously COVID, we had to sort of do that. That feels like a little blimp in history. But I feel like now people, I don't know, obviously you being in your line of work, you might have more experience or like have these conversations more, but people are like kind of longing for that person-to-person connection.
Yeah, I think it's been really interesting. I definitely got comfortable in that online space and was almost for a long time there. And yes, of course, with COVID, preferring that because there was something, particularly for an empath and being quite a sensitive person, there is something very easy about being boundaried online. You know, you can end the call, you can shut the laptop, and you can move on to the next person. But then, I always say to clients in regards to the work we do, it is exactly the same in person versus online.
Sure.
And depending on people's circumstances and context, there is always going to be that convenience. about being able to access therapy online. So I don't think it will ever go away. But yes, I have noticed over the last 12 months or so, and because of my own context as well, obviously, that that want for in-person connection again. And so having a combination, I think, is really important. But then, of course, you have some people who are like, online, nope, don't ever want to do that, and really prefer the in-person. I think it's a bit of both. But yeah, we're definitely seeing both in psychology and the therapy space, but also even in the yoga space, definitely more of that inkling back towards in-person and what that looks like. And yeah, I think as an industry, we're still trying to figure out the hybrid of the two.
Yeah, and it's really interesting you say that, because I also think the corporate and like the business and like outside of healthcare itself, everyone's kind of trying to get back to that face-to-face, but like you said, there's still those businesses, and that hybrid really works for some people, and it's now post-COVID a real option, and like just like in the healthcare landscape as well, you know. Probably, and I was just gonna say probably as well, like something that wasn't really tapped into too much prior to COVID, I would say, you know.
I think particularly for psychology and talking therapies, there was a real risk aversion to doing online around what it meant around privacy, confidentiality, in regards to the programs that we're using for the meetings, but then also what it looks like in the house setups, depending on the type of clientele you work with. I imagine particularly for you, Zeb, in the osteo space, like you're very limited in what you can do.
Difficult.
There. Yeah, very difficult.
And I think the interesting thing was, you know, obviously a lot of those manual therapy or like hands-on like physio, osteo, chiro was still running during the whole COVID landscape. But yeah, I mean, even little things like case histories being taken online, or, you know, like we're in a scenario where we used to take the whole case history, and you never really used to know what you were going to see before you rocked up on the day. Whereas nowadays there's, you know, case history forms that people have been able to fill out online before they come in. And that seems like itself is all a development post-COVID now kind of thing, because that technology is actually available now.
Yes, absolutely.
All right, but before we get down any rabbit, we said we were going to be there. There are rabbit holes everywhere. Okay, but why don't you talk to us a little bit about you and your kind of progress to where you are today, because you're obviously working within the psychology space.
And do a few other little things as well.
Little bits and pieces.
Yeah.
Tell us a little bit about that journey.
Yeah, sure. So I'm a psychologist and a trauma-sensitive yoga facilitator and a mind-body coach. And there's been so many breadcrumbs to get here, but essentially I have my own business called Mindfully Curious, and it is a bringing together of the mind and the body. So a lot of the traditional psychology training was in cognitions, thoughts, kind of this top-down approach. So start with the thoughts, and then maybe the body stuff comes afterwards, if at all. And so I had always had an interest and had been a dancer and a mover and a shaker for my life. I had done dance for HSC, and I had got to the end of my school career, and it was kind of choose psychology or choose dance was kind of the juncture I was at. Chose psychology. That was the respected thing, I suppose, at the time to do. But I always had kind of this inkling around movement being something that I wasn't quite ready to get rid of. And I didn't necessarily have language for that at the time, but I remember feeling a lot of grief around having to let that part of my life and my identity go as I moved into this other piece. But I knew I wanted to help people. And I'd always kind of had in my mind around counselling and that real traditional talk therapy space. And so went along that, and very traditional in uni, but it was very theory-based, and I got pretty agitated with that pretty quickly and wanted real-life experience, essentially. So I found myself in internships at drug and alcohol rehabs, so working with both mental health but drug and alcohol concerns. I worked with young people over in Western Sydney. I found myself doing private practice in the traditional sense, in the office-based sense, but then also I worked for a company that did walk and talk therapy as well. So we'd go to Cronulla Beach or down at Wollongong and we do walk and talk sessions as opposed to being in the office.
Nice.
And in the background, there was always dancing, yoga, movement and stuff happening. And I got to the end of my 4-year undergraduate degree and decided that I didn't want to go the clinical master's route. Research wasn't really my thing. So it felt very edgy at the time to go against, I guess, a lot of people's advice around me to not go the clinical master's path. And I chose to do a postgraduate diploma, which essentially was looking more at counselling skills, still doing uni for 1 year, but then more so focusing on being out in the world, experience working. I was lucky that I got a paid internship at that time, so I could work and study at the same time. So I very much have had this space of, I guess, doing things slightly differently to the traditional route. I started off doing the traditional route, and then I've just kind of followed these breadcrumbs. I think being a creative and being into movement, the traditional path of treatment protocols and sitting in an office all day, every day was, now I look back on it and I'm like, of course, that was never going to be a long-term thing for me. That was going to lead to burnout pretty quickly, and it did at times over the years. And I had always wanted to find a way to combine movement, the body, and the psychology, the talk therapy, helping people. I thought I was going to end up working with people predominantly who were experiencing anxiety and stress. That was a lot of what was coming up. But as I saw more and more clients, I realized that this anxiety and this stress label, actually there was a lot more to the human experience. And there's stories and there's experiences and there's events that would happen or that people would be a part of, that then that anxiety and that stress label would be slapped on, essentially. So I guess that's where the holistic approach started happening, that it was never just, oh, here's anxiety and here's your 10-step protocol. Yeah. It often blew out into a much more holistic, human, multifaceted space. And so that's where it has led today, where I now run a business working predominantly with women. And yes, stress, anxiety, burnout, all those things come up, but also I guess there's this banner word of trauma that comes up as well. And so helping women who have maybe felt disconnected, who are not sure of who they are, feeling quite empty, dysregulated, feeling just really overwhelmed with life, supporting them through usually different seasons of their life as they go. It's not just a 10 session and see you later. They're often much longer term relationships, which has been really beautiful to have those relationships evolve and change as they need over time.
I think that's so nice about being in private practice as well versus like clinical, like hospital role, say. You get to have that, long-term relationship with the client and sort of help them through, as you said, different chapters of their life. And yeah, it's really nice.
Yeah, and I think there's a lot of stigma around that longer-term therapy because our medical models are still, if we see Medicare, right, like the medical model is still set up as you do your 6 and your 4, you do your 10 sessions, you should be good to go and see you later. But as we know, life, our humanness is so much more complex than that. And, if we're talking about sustainable change, there needs to be longer term relationships of feeling held and safe and secure within that.
Yeah, similarly for us as well, like do you get 5 sessions?
I think we get 5 under the Medicare like EPC model.
And then people have finished their 5 and they're like, oh, I'm done now. I'm like, whoa, there's a lot more that we need to go through.
The layers, right?
Yeah, it's hard. And I think in a way sometimes it almost sets up this expectation for people too, that it's like, oh, okay, my doctor's giving me 5 sessions. So like 5 sessions down the line, like I'll be in the clear and sweet. But, as you were saying, like there's all these, they're almost like symptoms that come to the surface. And then there's this whole backstory or history that you kind of try and really start to unpack with people during those initial consultations. Have you found that like people are asking the question, why, like, is this coming about, or why am I experiencing this, or why am I like seeing this stress and anxiety start to surface its head?
Yeah, for sure. And before we go into the why stuff, just to note around the limited sessions, I find that a lot of people then walk away if they aren't feeling better.
Yeah.
And it almost reinforces this feeling of, I'm a failure, I'm not good enough, what's wrong with me, see, I am broken. You know, it reinforces that pathology that is set up in our medical system, unfortunately, as opposed to what I guess I'm really passionate about is going, you're a human, having a human experience, and it's okay that there is suffering and that there's more layers, right? So yes, a lot of the time people are coming into sessions and saying, why is this happening?
Yeah.
And I always talk to women about we can understand the why. I mean, we're cognitive, meaning-making, problem-solving humans.
Yep.
We want to understand the why. It's really important, and, you know, we can't change something unless we first understand it. Yeah. So the understanding is really important, but we also don't want to get stuck in the why either. Yeah. And what we know around the research, and it's a very slow, as we know, practice is often really far behind the research in regards to years and years and years.
Yes.
So what we know is that we can try to figure out the why, but there's also a lot of that is unconscious and that we can't know. You know, what's most profound for me at the moment, obviously just coming back from maternity leave and the season of life I'm in, the womb, intergenerational, you know, trauma, or not even trauma, but also resourcing. Like, there is so much before we land here as our own person that we don't know, that we don't see. And so we can have some understanding of the why, the anxiety, the stress, etc., the symptoms are showing up as they are. But there's often going to be a whole backstory that we can have an inkling of, but we may not be totally aware of. But what we can do is go, okay, we can have an understanding of why, but we don't need to get caught in that. We can also work with what is right now and also look at moving forward. And I suppose that's where kind of the mind-body coaching stuff came up for me, because psychology is often, as you're alluding to, speaks of symptoms, pathology, the stuff we have to fix to make better. If we think of a spectrum from survival to thriving, psychology is often at this end of how do we get you back to, you know, daily functioning, essentially. Again, often with the I'm fixed, I'm broken, there's something wrong with me. Whereas coaching is more moving from I'm functioning, but I actually want to be in thriving. I want to be doing even more. Yeah. So coaching is more looking future focused and, I guess more of that, I guess we can say like the goal setting and the moving forward. And so I think even though there is a lot of this opposite camps, I suppose, of the psychology and the coaching world, there can actually be a beautiful blending of the two.
And because as well, like you said, you fluctuate between those. Yeah. Right? Like it's never smooth sailing. It's never you're solely in one side or solely in the other. Like you're constantly navigating that space between both elements.
Yeah. And, you know, it then, you know, we can go down the rabbit hole, I suppose, of the diagnoses stuff where it's, you know, questioning around how supportive that is for each person. Yes, it's helpful in regards to funding, to having a label for something, for understanding, and yet do we then get stuck in the diagnoses or are we looking at the full spectrum of the human experience?
Like, this is me, I have PTSD, I'm going to be stuck with this for the rest of my life. And it's sort of like, I don't know, again, I'm just sort of thinking about clients that I have encountered, and I'm by no means a psychologist, but then they sort of just like live their life according to that label. Yeah, there can be that real confirmation bias, I suppose. That's the fancy word I was missing.
I mean, we don't have to be fancy about it. But that whole idea of, if I am, you know, sick or I am broken or yes, I do have PTSD or anxiety, this is just my lot in life. And we can get quite stuck in the victimhood. And I suppose earlier on in my career, I was seeing that a lot. I was doing a lot of validating and sitting with people's stories, which of course absolutely necessary. But to the point then no change was being affected. I think there's a very fine line, and this might be a bit controversial, but there's a very fine line between validating and how powerful and necessary that is versus, I suppose we could call it maybe the over-validating or the over-reassuring that keeps people maybe stuck in their victim mode, essentially, as opposed to
creating that identity kind of.
Yeah, as opposed to being agents and being able to affect change in their own life.
It's really interesting you say that, and I'm keen to get your take on it. We've spoken to a few people recently about, that real forward thinking or being on the front foot with things. Now, have you found there's been a bigger uptake with people being more interested of being like, yep, so I'm in this functional space, I'm not in the survival space. Like, how do I get to that next level?
I want to be better.
Yeah, I want to be better. Like, I want to be, preventative or proactive in my approach to like my overall health and well-being.
As in, am I seeing more people present in that way? I think it's slowly starting to change, and I think it depends on the context of which you work as well. Like, what you were saying before around the hospital setting, for example, that's very different, and particularly the mental health hospital setting, that's very different as opposed to a private practice that I'm running that is more focused on women who actually usually are high functioning. They're doing all the things. But it's the inside that they feel like they're drowning and they're struggling. So, yes, I think there is more of a move towards, we can seek therapy or we can seek mental health support without being like deeply in the trenches of, say suicidal thoughts or panic attacks. We don't have to let it get to that stage before we seek help. I think that's slowly starting to change, but I think there's still a lot of taboo around, but everyone thinks I have my shit together, so, I don't need that.
Yeah. You still see some of that overhang of like, I'm strong, I don't need support.
Yeah. And I guess what I've seen, particularly in my business shift over time, there is a missing space for those people. I say women because I work with women, but just people generally, right? There is this missing space, and I still see people come in being like, I didn't get a mental health care plan because I didn't meet the criteria for X, Y, Z. And even that is a barrier in itself. I am that firm believer we should all have, that right to those sessions and, that at least that partial rebate. And if people are somewhat functioning, I suppose that system becomes reactive in that we have to wait until they're
fall into that survive.
It's like a triage.
Yeah. As opposed to, can we be okay and still do the work or want to do even better?
Yeah, we were talking to, I reckon it was Chapo we spoke to originally about it, and he made a really good reference to the fact that, we're still in that reactive landscape of like waiting for people to get there before we get on the front foot. Whereas like, I think as a population, we would save ourselves so much, whether it's like funding or, and like even chatting with Amelia, her mindset around, for every dollar you spend in preventative or proactive healthcare, you save something like, the stat was like $7 on the other end of things, which is crazy, But
sorry, you go.
I was just gonna say, I suppose it does just come to that slow moving like awareness and slow moving education, that just takes time.
Yeah, even what you were saying with the like criteria for certain plans, like reflecting on my own practice, if someone might come with disordered eating, who very much needs support, they do the questionnaire for like the eating disorder plan, say, and they just fall short of that criteria. So then they drop out of care because they can't afford it. And it's like, well, 6 months down the track, they very well could qualify for an eating disorder. Like, we kind of need to stop things now and work on that. It's there's a lot to do.
And even you think about burnout and people taking time off work. If there was preventative measures of course, right, like the disclaimer around this is it's so complex. There are so many, like there's the individual and there's all the systemic stuff that comes into this. But even burnout, I can't remember what the stats are, but there is some really important research that has come out around the amount of money that people and companies lose because of people taking sick days from burnout, as opposed to if there was preventative care, even from that financial perspective, it can look worlds different.
For sure. And obviously, as you were saying before, like a big part of your cohort or client base is women who have those experiences of trauma. Speaking of labels, like one label that is often assigned is complex post-traumatic stress disorder.
Yeah.
No, sorry, post-traumatic stress disorder, PTSD, and then there's the complex side as well.
Yeah.
For those that are listening that aren't quite sure what that actually means and even just how the two differentiate, how would you explain that?
Sure. So before we go into those specific definitions, to come right back to trauma versus traumatized and what trauma actually means. Huge buzzword at the moment. It's thrown all around social media. So trauma, there are lots of definitions, but I guess if we're looking at it from this general space, trauma is anything that is viewed as scary, uncertain, or distressing to a person. Now, obviously, that is so general.
Yeah.
So general. And there are schools of thought that talk about big T and little t traumas. I have a bit of an issue with that one because I think if it's traumatizing to the person, who are we to judge and say whether it is or isn't big or little for them because it's their experience. But trauma is different to traumatized, right? So just because you have had a traumatic experience, whether that is single incident, which is where PTSD comes from, so a single incident could be a natural disaster, could be a motor vehicle accident, could be a near-death experience, those single incident events. Just because they happen doesn't mean you're going to be traumatized. So we talk about acute stress, which is in the first month post an event. We would expect there to be some symptoms happening with your nervous system, being like, what the fuck just happened, right? So shock, anxiety, maybe some avoidance, maybe some rehashing of the event over in your mind. All of that is very normal. In saying that, part of our training is pathologizing that as acute stress disorder.
Yep.
Right? Are you with me so far?
Yes.
I'm following. My mind.
Okay. I feel like I know I just like chucked all these things in and then I was like, whoa.
No, that was great. That was really good.
So in the first month, most people are going to develop some kind of acute stress symptoms.
Yeah.
Right? After that, if it goes longer than a month, those symptoms, we're then looking more at that post-traumatic stress disorder space.
Right.
And then to add further complication, we then have complex post-traumatic stress disorder, which is cumulative, repeated, chronic stressors or trauma over time.
So multiple incidents.
Could be multiple incidents. It's usually relational.
Okay.
Right? So it can look like, childhood emotional neglect, or it could look like DV or family concerns. It is usually in relation with another.
Yep.
And so, as you can imagine, that's very different to, say, a single motor vehicle accident.
Yeah.
And so trauma is different to traumatized. And it depends on our resources and our coping and a whole lot of different factors that come into it. And particularly when I was doing my training, a lot of the focus was on PTSD, single incident. And even now in our diagnosis, it's DSM, so the manual where all the pathologies and the diagnosis come in. There is still not a differentiation between PTSD and CPTSD.
Right. Yeah, because I was saying to Maddie, like, even PTSD was something that I'd never really heard about or seen written anywhere from the perspective of whether I was managing patients or how sometimes with your care plans you get, a big list of the things that they're managing.
Yeah.
It wasn't something that I'd necessarily seen or even really knew about, to be honest.
Yeah, and again, there's this lag between practice versus research.
Yes.
So the DSM, the last, I think it came out in 2012 or 2013. It's been a long time, but there was a revised edition in 2022.
Yeah.
And the guns that be, people who make all these decisions, had said that there wasn't enough differentiation between the two. And yet with another manual, I suppose, overseas, the ICD, they have actually said, yes, there is enough differentiation. So, yeah, it's an ongoing debate and conversation, I suppose, in the industry. And what I was finding was I was getting women come in who were saying, I'm anxious or I'm stressed. Didn't quite meet the criteria, I suppose, for PTSD, but there was definitely trauma there. Yeah. There was definitely a lot of relational issues there, a lot of feeling of what's wrong with me? I'm not good enough. I'm broken. Not feeling like they can connect with others, or they'd be in connection with others but still feel a sense of loneliness, or they'd be in connection with others and lose a sense of themselves and just be in the other person, in the other person's energy all the time kind of thing. So there was all this relational stuff coming up, and, complex PTSD was almost the closest thing to
what they were kind of experiencing.
Yeah, putting a label on it. Yeah, if the label fit. And sometimes we talk about it as complex PTSD. Sometimes we talk about it as trauma. Sometimes we talk about it as attachment and relational issues that we're working on. So again, it is up to the individual around whether those labels land for them and help them understand it as a framework, or whether actually the labels are less important and we're just working with your human experience and relationships, and that's enough.
And what are the steps that those kind of people usually will try and essentially, or the paths that they'll go down before they actually end up with you talking about some of this stuff? Because I can imagine, not fitting into some of those real regimented categories can be quite, what's the word that I'm looking for? Can flare up almost their symptoms too, from the perspective of, if they're not meeting the criteria for some of these pathologies, it's like what we were talking about before. What's wrong with me? Why aren't I meeting?
Which is
something's wrong, but I don't know what's wrong.
Yep, and that's the presentation. That's usually when women are walking through the doors being like, I've tried to keep my cool about this for a long time, but I'm still feeling crazy. What's wrong with me? I don't meet these criteria. I don't quite fit with this. I don't quite fit with that. But this isn't right. Yeah. Something's not. I'm not feeling fulfilled. I'm not coping in the way I want to be. And sometimes, there's perfectionism and unrealistic expectations around what that coping looks like. Yeah. But there's usually this body sense of something's not right here for me. And so it's unpacking what that actually means for the person. And I think this is where the mind-body stuff comes in really beautifully, because it is often people turning up and being like, something's not quite right. I don't know how to explain it. It's just a feeling. Yeah. And then we can work from there. So it's less of a cognitive, here are the symptoms and this is what I'm seeing. It's just
a feeling. And in your experience in practice, do you find that those people who have tried to seek clarification around what's going on for them, they've tried different, modalities of therapy like DBT, CBT, whatever have you, and they're finding that those skills and strategies that often are, that top-down approach just aren't working?
Yeah, it is often women will come in and being like, I intellectually understand what's happening, but it's not changing the body, it's not changing the heart, or I'm finding that I just keep repeating the same patterns over and over, even though logically, intellectually, things could be different. And I think this is where it's really important to start to differentiate the single incident PTSD trauma stuff versus the complex, the relational over time stuff, because treatment-wise, it looks very different. Okay. Right? Like if we're doing trauma processing for a single incident event, we can go in, whether it's EMDR or something like that, we can go in and we can work through that. If we're talking about cumulative effect over time and relational trauma over time, we're not going to go back into every single episode. Like you would just never get through it. And we understand that there is now research around once you work with one memory, it operates like a network. So it will often have a knock-on effect to other things. But again, we also know we don't have to go back into the actual memory to affect change in our life.
Okay.
Right? We don't have to go into the specifics. Tell me your question again, because I've gone on a tangent.
No, that was really helpful. I guess it wasn't necessarily a question. It was more so that women who have, and I'm just reflecting on, again, clients sort of sharing that
Yes.
I've tried all these things and no therapy
Yes.
works for me. Like,
Yes.
and they feel defective.
Yeah.
Yes, the defective thing is huge. So we'll often have women come through who have either tried to be doing it themselves for a long time or have had experience of therapy before where it hasn't landed. So something about the therapeutic relationship hasn't felt right. Or they've been told that you're doing great. What's the problem?
Yeah.
You're fine. You're going
Yeah,
your
you've
way.
passed all. You've jumped
Yep.
over every hurdle.
Yep.
Yeah.
You're like, you're holding all the puzzle pieces,
Yeah.
right? So there's this invalidation or this glossing over of, but I'm saying something feels not right, even though I don't know how to describe that.
Yeah.
Do you find that it coexists, like, and just trying to tie this into that whole mind-body experience? And
Yeah.
I know, I hope you don't mind me saying, I know you've got like some experience of as well, like using some co-regulatory kind of practices to manage kind of nervous system, mind and body together.
Mm-hmm.
Do you find that you see, people coming into the practice who are mentally going through it, but also physically going through it in their body? Like,
Yeah.
and obviously like not being able to make diagnosis on musculoskeletal conditions and all that kind of stuff, but like seeing them experience, like whether it's like a mention of, oh yeah, I'm going to see like an osteo on the side for this ache and pain or this thing that's kind of popped up recently.
Yeah, it's kind of like there's these two roads that aren't quite matching up. They're not quite meeting. So often, as I spoke before, it will be high functioning, usually very intelligent women and people who know it all, and yet their body is either totally disconnected, like there's just no movement in the body, or there's a lot of movement. And it's like, okay, you're sitting here and you're telling me you're calm, but your body is telling me a totally different story.
Fidgeting.
Yeah. And the amount of times I will have people saying, oh, but, it's this stuff going on in my life, and if this person would just, do this, and yet their body is having a whole different response. And not placing the blame on the person at all, but it's like our nervous system, even if we don't, kind of coming back to what we were talking about before, right? Even if we don't know the why, the history, in that first session, if we don't get into history, it actually doesn't matter.
Yeah.
Because you sitting there on the couch, your body is saying everything. And that's not to be like, oh my God, she's coming in and analysing me and But, our bodies speak to each other.
Yeah.
And again, this is the stuff that is less spoken about in psychology. There's pieces of it for sure, but there is still a lot of focus on the cognition and the thought and what people are saying.
Yeah.
Versus, you guys know what it's like when you say something, but it's like the body can feel different.
Yeah.
Or you walk into a room and someone's like, I'm fine. And it's like, you are not fine. So, there is often this disconnect. And I will often say to people, how's your body feel? How are you feeling in your body? And the amount of times I get the deer in the headlights or the blank look being like, what do you mean? It's fine. I'm just sitting here on the couch. Okay. Can we explore that a little bit more? And it's like, even maybe as I'm prompting this now, it's like, oh, yep, starting to feel it.
Yeah, I know. It's just like, how am I sitting?
My butt kind of hurts.
It's like, it's such a powerful question because we are in a society that is head up.
Yeah.
We don't give a lot of attention to this.
Yeah.
We've been taught to disconnect. We're in a busy, fast-paced hustle culture. Shit needs to get done. Ain't no time to reflect on this.
Yeah.
So it's like we're all up here and go, go, go. And so when people come in and it's like, actually, can we just sit for a second and check in?
Yeah.
We might start to notice, there's some aches and pains, or, I'm feeling a bit shaky. There's some adrenaline. And that's then when the work begins.
Yep.
Do you ever encounter people that are just completely disconnected? Like you might ask that question, they're like, I don't know. Like, how do I work that out?
Yeah. More times, it goes one of two ways. Again, the spectrum, right? It goes one of two ways. Yeah. It's either what do you mean I'm sitting here on the couch? You're asking me crazy things. Like, I'm here. What more do you want?
Yeah.
Or the other, that they're so much in their body and their sensations and aware of everything that they can't get stuff done and they're too preoccupied with it.
Yeah.
I talk to a lot of people about this theory by Dr. Dan Siegel called the window of tolerance. And it essentially looks at what our nervous system can cope and what it tolerates over time. And I find that people are in one of two camps. So to pull back for a second, if we look at the window of tolerance, we all have a window of what our nervous system, our survival energy can cope with. And based on our life experiences, this is very simplistic, by the way, but just for
We like
a snippet.
simple.
Yep, just for a snippet. Based on our life experiences, what we can handle is going to expand or it's going to shrink. You know that feeling of like, I'm anxious, I'm stressed, and I can't take on anymore. And I'm
Today I'm at my wit's end.
yeah, wit's end. Yeah, your window of tolerance
Yeah.
is really small
Yeah.
at that point, right? And then on the days where, you know, you've slept well and you've been doing things you enjoy with people you enjoy, the window's going to expand. You've got more resilience against your stresses
Yeah.
and what we call the allostatic load, so the cumulative stress that's put on us every day. And we can be in our window, which of course ideally is where we want to be, the cool, calm, collected, functioning, doing all the things space. We can be on the edges of the window, right? So it's like I'm feeling a bit dysregulated, a bit out of sorts, but I'm still managing. And then we have the two extremes. So the hyperarousal, which if you think like the volcano, it's like I'm just like the anxious, the panic attacks, the anger, like I can't hold the energy in my body anymore. It has to go somewhere. And these are often the anxious people who are feeling a lot in their body and they don't know what to do with it. So it just comes out in all these potentially unhelpful spaces. Or we have the opposite, which is hypoarousal. So I use that analogy of like an iceberg. It's just numb, frozen, disconnect, cut off.
Yeah.
And we will often flip between the two, but one is often more familiar than the other. So yeah, we often have those two presentations of too much in the body or not enough in the body. And so depending on where people are at, what their goals are, what they're looking for, it's one, where's your window of tolerance and where are you at? Again, can't make changes if we're not even aware of it, right? So sometimes it will be them finding that, but also me facilitating and guiding and helping them start to zone into their body a little bit, and just a little bit, right? Not, hey, if you've never been in your body before, we're going to sit here for 10 minutes and be in your body and do some breath work and meditate and do yoga. It's like, no, we're just going to ask that question. And if you go, oh, I don't know, great, that's information in itself. Then we can go back into story.
Yeah.
Then we can come back and check in a little bit more. Then we can go back into story and come back a little bit more. So there's this real gentle approach to it as opposed to let's go and heal the thing now.
Yeah.
Right? So yeah, the window of tolerance is a really great starting point for people around where am I? Am I connected or disconnected? And then from there we can start to get information around, okay, do I need to find ways of necessarily being less in your body, but finding it more tolerable to be in your body,
Yeah.
in either bringing some of that activation back down, or am I disconnected and I need to activate the body more and bring myself into feeling and sensation again.
And I was going to say, I feel like this leads really nicely into like some practical stuff that you're able to kind of do with your clients, or that you've kind of experienced doing with your clients. So walk us through a little bit of some of the trauma-informed yoga stuff too, because that's something that you kind of use in your practice. Is that right?
Once sort of someone does identify as a good fit for more of those somatic-based therapies, what does the how look like?
Yeah, so it is, as I was speaking to, psychoeducation is really important.
Yeah.
Again, appealing to the cognitive brain first to get an understanding of where we're going before we go there.
Yeah.
I think earlier on I was so excited about, I'm a very body-based person, so for me it was just like, oh, I want to go there, you know, and that is not the experience for everyone. And if we're talking about trauma-informed practices, we very much need to work where people are at.
Yeah.
And, you know, the body, part of trauma or being traumatized is the body becomes a really scary place, either too much or too little, and it is not necessarily a joyful or a great place to be. And so this is, you know, the quick fixes or the 10 steps to healing trauma. I want to say it's bullshit, but that might be. I think it's more complex than that. But I think it's you're playing with fire if that's the marketing you're putting out there. Because what we know is that if we go too hard, too fast, the nervous system gets flooded, overwhelmed, and people are going to opt out. That's why people are comfortable in talk therapy. That's why people will stay in talk therapy for decades and decades. It helps, absolutely, but it only goes so far. And that's why we will see the revolving door of psychology of people coming back over and over and over. Because it's like we've changed this, but we haven't actually shifted the nervous system patterns that are often unconscious or less in our awareness, I suppose. Automatic. They are often more automatic. So to answer your question, of which
The how.
And yeah, I think, look, to answer that question simplistically is hard because it's complex. So this is why I'm like, where are all the places I can go? Because it depends on the person who's sitting in front of me and what their nervous system is telling me. And what their story and their experience is. So for some people, it is very much like we go there and we're in the body and, you know, there's resourcing there that they can already do. But for other people, it's like, actually, we're just going to go more into, like you said, the history taking. And we're just going to really slowly go, how's the body doing now?
Dip the
How are you
toes in.
noticing?
Yeah.
Oh, I noticed you take a breath out. What's that like? Did you notice you were holding your breath before? You know, so it's lots of curiosity and inquiry, and a lot of the work is following people's nervous system. So the how, to come back to the trauma-sensitive yoga question you're asking, trauma-sensitive yoga is one of the many access points. Right? So some people will do breath, some people do meditation, some people will do sport, some people, like there are so many ways to have access points.
Does it kind of make up that group of co-regulators or things that you're kind of using to ground you a little bit, or?
So we have 3 types of regulation. We have self-regulation, which is the very specific things we do in our body. That could be the meditation, the breath work, looking after your nutrition, like the real intentional things you do to regulate. Then we have auto-regulation, which is maybe it is the scrolling on the phone, the zoning out on Netflix, the automatic things that our body leans towards to regulate, even if we're not cognitively making the decision. And auto-regulation gets a bad rap. Right? It's like, oh, we shouldn't do this and we shouldn't do that. But it's like, it's actually our body and its intelligence going, I'm overwhelmed. I need to cope right now. I'm feeling too much activation and energy. Maybe I just need to numb out for a bit and then find balance again. What goes up must come down, right? And then we have co-regulation, which is when I can't do it myself, how are the people around me? And it can be both human and non-human types around me. Nature being one can be a really great regulator. But yes, also allied health professionals.
Animals.
Right? Animals. Beautiful one. You don't,
Walter.
right?
You haven't met Walter yet, but he is.
So, and so Zeb, like even just that, right? Like your body just automatically went,
Just thinking
That's
about
regu-
Walter.
Walter's my little part.
I have seen some photos of Walter
Therapy dog.
in the social media land.
He's a future co-regulator in practice. I'm going to bring. Oh, actually, last
Totally.
week he came in for a session with a client, slept on her lap the whole time.
Oh.
Yeah.
Awesome.
Yeah.
Yep.
And so you can just see, like, literally, like, he's not here.
Yeah.
But even just the thought of him, it's like, we're like, oh,
Zoned out.
right?
Sausage.
And so this is the beautiful piece around when we're talking to people. It's not necessarily going, oh, here are the new things you need to learn around breath work and meditation and movement. It's like, what are the resources that are already there?
Yeah.
And actually starting to give people an awareness of the resources and the coping that you already have in your life, because there's always something, right? And yes, pets, dogs, nature, they're the beautiful things that you were literally in the history taking, right? Like, you will see if someone's talking about their pet and they're like, oh, and this, like their whole demeanor, their nervous system literally changes, right? And so that is a beautiful example of the kinds of things that we would be doing in therapy, right? It's less about the doom and gloom and the resources and capacity. Trauma-sensitive yoga can potentially be one of those things.
Okay.
Yeah.
The word yoga, it's a tricky one because people have all the associations with yoga.
Like
around
Warrior One pose. And
being flexible, being strong. I have to follow this pose. I have to do this sequence. I have to keep up. And trauma-sensitive yoga, I would just, it almost kind of needs I don't know what you'd call it.
A revamp, a rebrand.
It's a rebrand because, it's always debunking all of that stuff around it first before people necessarily walk into the door. And I think the yoga space is changing as well because there is becoming more awareness around mental health and trauma-informed care. But trauma-informed yoga or trauma-sensitive yoga is essentially movement that is very gentle. There's lots of choice given, and this idea of checking in with your window of tolerance and where you're at and taking effective action in your body. So even though we're thinking of trauma-sensitive yoga of, we've got to lay out the mat and we've got to do the sequences, Warrior One, it's like we could literally do, quote unquote, trauma-sensitive yoga here, right? It's like, well, how's your neck doing right now?
Right.
How's your shoulders? Are you happy leaning forward or do you want to lean back?
Is that checking in?
Yeah. Is there a lot of activation in your body that you need to kind of shake it out, or is there a roll of the shoulders that is needed? And so in a trauma-sensitive yoga class, there is, we might do what we call like a child shape or a warrior shape. We call them shapes rather than poses because pose can have some connotations with trauma, particularly if there's been childhood trauma. Or sexual trauma, right? So we call them shapes as opposed to poses. But this idea of if you choose or if you would like, you might like to check in here. Or you might like to ignore what I'm saying and do something totally different. So there's lots of choice given. And the reason why that can be so powerful is because when trauma happens and traumatization has happened as a result, there isn't choice. There isn't power. There isn't agency. So movement or trauma-sensitive yoga can be a beautiful way of creating choice and agency back over your body again. And that can be quite different to maybe more community-based yoga, which is do this sequence, do this pose, do it in this right way, which can often be re-traumatizing.
Yeah, okay, I'm with you. And so, like, a lot of the time, like, would you say, because do they actually do trauma yoga style classes, or is it more, does it tend to be that more kind of personal? I've never,
There's a couple in Sydney, I think.
Really?
Well, it's
a very small community. It's, earlier on in my career, I heard a lot about dance movement therapy and things like that overseas. Somatic movement therapy, which one of my mentors, he does. That was kind of the closest thing I could find. There's not a lot in Australia. We're a bit backwards, but I have actually seen, in the 6 years or so I've been doing this, I'd say probably in the last 2 or 3 years, there's becoming a lot more awareness around this, which is great to see. You are seeing a lot more psychologists who are doing the trauma-sensitive yoga as well, seeing a lot more yoga teachers who are being mental health trained. They just go so hand in hand that once you know it, you can't unknow it. It's kind of crazy that it's been in 2 separate baskets for so long. But yes, you can do one-to-one individual, or you can do group, or you can also do, like, I have an online program that people can do in their own space and time, and it's pre-recorded. I guess the difference between community yoga versus trauma-sensitive yoga, not only is the invitational language and the choice-making really important based on your nervous system and where it's at moment to moment, but there's also no hands-on assist either. So you're not having a teacher the reason I'm called a trauma-sensitive yoga facilitator is because I don't teach. I'm not teaching you what to do with your body. I'm inviting you into an experience that you're checking in, you're using your discernment, and you're finding what works for you.
Yeah.
Right? And so that's very different to someone coming along going like, oh, your alignment's out, or you need to do this, or
That's wrong, that's right.
Yeah. And particularly if you think about women, perfectionism, unrealistic expectations on themselves, feeling like they're already broken or something's wrong with me, those kind of environments can just basically reinforce those defective feelings that are happening. So I that would be the main qualities that are different in that regard.
Yeah.
Fantastic. And like I said, the only reason I ask is 'cause so curious because I just hadn't heard of it too much. And, you know, the fact that it's only starting to really come through, like you said, I mean, you know, we are a step behind the 8 ball sometimes here in Australia. Well, actually, you know, after last episode, I said that and it was really nice because the guests kind of reminded me that actually we're really well equipped here in Australia. We have a lot of access to a lot of different things.
We do.
Yes.
We do.
But yeah, it's so nice to see like different aspects of that model starting to come through and come to fruition.
I liken it to like Zeb and I do a Pilates class once a week together.
Yes,
Or
yes.
I've
just
starting to
started.
come.
Yeah.
So have I.
Nice.
But we've done one. But so now it's a thing apparently.
It's now a thing
that.
as of this
Yeah.
week.
But the
Antic.
fact if someone has those experience like CPTSD, saying they're going to that sort of class where it is quite fast paced and you have to keep up and you have to do it right, it could be quite disheartening to be like, what's wrong with me? I can't do this pose. And mind you, it's pretty fucking hard. Like
Yeah, really
Breath
fucking hard.
work is something that this comes up a lot of the time, right? Yeah, Pilates is a great example.
Yeah.
Breath work being another one, particularly that I don't know if you guys have ever done like the breath work journeys where it's
do love
quite
breath work.
instructional. Yeah, it's great, but also
It's a lot.
it's activating.
yeah.
Right?
Oh, I bore my eyes out like 9 times out of 10. Yeah.
Yeah. And if you are someone who, you know, doesn't necessarily have the resources or the evidence or that confirmation bias that you can cope with those big emotions in your body or that big activation in the body, someone going, good job, just keep going, when your whole body is screaming, this is too much, this is too much.
Yeah.
Again, we're just back in flooding and re-traumatization.
Yeah.
So again, these modalities, it's not just shit on the modalities. They're beautiful and they serve a purpose, but we have to make sure that people are resourced. And not that it's necessarily the facilitator's responsibility to make sure everyone's resourced in the group, right? Like if you're choosing to turn up, that's your job to do.
Yeah.
But as the person facilitating it, there has to be an awareness of people are coming with their histories, they're complex.
Yes.
And whilst you're having this activating, amazing experience, it doesn't necessarily mean it's going to be the same.
Yeah. Because I've been to a few community-based ones and they're fantastic and I do consider myself quite well resourced in that regard. But thinking about someone who might not be as well off as I am in that sense, like there's no pre-intake, like there's no history take and it's sort of just like rock up, dive in, go home.
Yeah.
Like, it'd be a lot.
Yeah. And if we're talking about complex PTSD,
Yeah.
this healing happens slowly over time.
Yeah.
Our nervous system is not going to radically change in a breath session.
Yeah.
Yes, we might have an epiphany, but there needs to be integration after that. And I think a lot of, particularly the social media land or the Bali retreats or, all this beautiful, but also if there isn't an integration piece with that, I did my, before Mindfully Curious, my business was born in end of 2018. I had done a month in Bali for my yoga teacher training. And what excited me so much about this yoga teacher training was it was the first training that I had found that really brought together not just breath work and spirituality and yoga, obviously, but also brought in parts of psychology and physiology. So we were, rather than just learning how to teach, we were going in and like embodying what is it like to be in a meditative space and experience our lungs or our heart or our feet or our fascia. What is the quality of what would the quality of the fascia be as opposed to the quality of our blood? If we were to imagine being back in the womb, what would that be like? Like it's a whole other rabbit hole that we can go into. But it was this beautiful bringing together of the physiology stuff that I don't see a lot of necessarily in the yoga space, as well as all the other stuff. And my point of speaking to this was, I did a month in Bali. Amazing, brilliant. Like, I'm in the depths of it, like life-changing experiences. Came back home, reverse culture shock.
Yeah.
Right? There wasn't enough integration. And, you know, you don't know these things. And now there's much more integration with the programs. It's beautiful. They've learned what they've learned. But at the time, for me particularly, being highly sensitive and empathic, I went from having this beautiful experience to landing back home and you know, I'd been out in Bali in the rice paddies for a month, and I came back home to a concrete jungle, and I was like, what the fuck is this? Yeah. And I just give that example as, you know, someone who is quite well-resourced and yet still really, really struggled with that transition of having these beautiful experiences, but yet if we can't integrate this stuff back into our everyday life, it is going to create havoc for the nervous system, because the nervous system is going to be like, what the fuck just happened?
Yeah.
And this is why we see that revolving door of psychology happen over and over, because we need to do it bit by bit to give our nervous system time to repattern and create new.
Yeah.
I think that speaks really nicely to kind of like our overarching theme of the podcast, which is like everyone is essentially their own individual, and like people experience stuff so differently. So some people just don't know what works for them yet. And like you said, it can be a real kind of experimental process, but also a process of slowly but surely understanding what, you know, is the right fit for them.
Someone might be listening and not even know what, you know, somatic therapy is, say, or that there were alternate types of therapy that weren't just talking.
Yeah, exactly right. And I think that word you use, Zeb, around process is really important. We can have content-oriented ways of therapy or being in the world, which is the learning, the understanding, the cognitive, or we can have the process, which is how do I experience this and what does that feel like for me? And I suppose that's why I find it so difficult when people say, what are the action steps? Or how do I do this? Or even, you know, like social media, right? Like it's like within 30 seconds, give them the thing that's going to help them. And it's like it's going to be, they're invitational. Sure, I can put out an invitation to do a 30-second check-in with the body, but everyone's going to have a vastly different experience. And so to have someone that can hold that space for you and co-regulate with you whilst you explore that is really important, right? So it's not like, oh, I'm just flailing around doing this by myself. It's like, okay, we can be curious here, right? Curiosity is the opposite of fear. We can't be fearful and curious at the same time. So it's like, oh, if I'm really fearful of my body, how can I have a co-regulator or an ally to come in and be curious with me? And we just do it bit by bit. And when your nervous system goes, whoa, that's fucking scary, okay, we back right off. We listen to that. We don't go, no, just hang out here, figure it out, persevere. It's like, no, let's just pull back. And I think particularly for the women I work with who are the high achieving, go, that's a very, very different way of being in the world.
Sorry.
No, you go.
I feel like I've cut you off so many times. Sorry. I was going to say, do you ever get clients that are like, so what's my homework today? Like, what do you want me to do?
The women who comes with the journal and it's like, yep, I'm taking all these notes down and what's my homework? And again, that is a part of the person who's great at coping. So we also don't shame that and be like, oh, that person. It's like, oh, great. Okay, that's a resource that really helps. So let's lean into that because that's safety, right? That makes me feel in control and that's great. And yet also let's pair this with maybe sometimes we don't have homework. Or maybe it's more of a less writing it down and recording things. Maybe we notice. Maybe we notice, oh, how often we want to jump to the journal and figure it all out, as opposed to, can I maybe sit with this for 5 or 10 more seconds before I jump into the journal stuff, right? So starting to, again, just really gently being curious around our patterns and our nervous system responses.
This has been amazing. Like, I'm so interested in this space. I feel like this conversation is like,
I know.
Very good.
I know. We've covered a lot today as well.
And
it has been fantastic to have you in and unpack some of this stuff. If people are looking to find you somewhere, where can they find you?
Yeah, sure. So the socials, so Instagram, mindfully.curious.
We'll pop it in the show notes.
Just look up Mindfully Curious, I suppose, and website mindfullycurious.org. So, yeah, you'll find all my stuff there with, open referrals for 2025. So both in-person and online sessions are available. I also have little free resources on the website and workshops that are so much more cost effective that people can do, just some one-off trauma sensitive yoga classes if they want to get a feel for it. And I haven't worked out when I'm going to launch it, but there will be at some point this year my 10-week online trauma sensitive yoga course as well, which basically brings all this nervous system stuff, the educational stuff as well as the experiencing stuff into, I mean, if we're going to look at how, I guess that's my closest how to 10-week program that you're going to find. Yeah.
As I was saying, I send so many of my clients your way. I'm like, try this, do this, particularly those that are a little bit hesitant, I guess, to engage in the community style classes, like doing the online at home in their safety zone is really, I think would be really helpful.
Yeah, and just a quick note on that, I think that's also the beautiful thing about trauma sensitive yoga. It gives you that ability to be with yourself and build that confidence within yourself for those people who have been really hesitant to go into those more community-based classes as well. Yeah, I often see people will build the confidence and then go, and I found my community after that as well. Yeah.
I'm going to throw you a curveball if that's okay. And
we
you can tell me that this is not okay because I know this is very off the cusp. If someone was listening, I guess, do you have sort of, if someone were to take one thing away from our talk today, maybe they are experiencing PTSD or not quite sure what the label is, but they just don't feel right and they've tried different things in the past. What would your sort of, I guess, main take-home point for them be? That's a big one, I know.
No, that's okay. Before I dive in, I'm like, actually, let's practice what we preach and check in for a second.
Like, fuck you, Maddie.
No, not at all. Not at all. I'm like, what will have the most value? The first piece around it, even though you're not going to believe it right now, you're not broken, you're not crazy, and there's nothing wrong with you. If there is that feeling there of wanting things to be better, they can be better. And to be curious about that and follow those breadcrumbs, whether it is reaching out to someone in your life, journaling, seeking that support, going and following my stuff if it supports that feeling you have, you get to notice that and trust that. You don't have to keep pushing that away anymore. Yeah. That's enough.
That was very beautiful.
That was great.
Thank you. Apologies, but also I think that was awesome.
No apologies needed.
Yeah. Thank you so much for today. It's been awesome. First guest of the year.
I loved it. First guest of the year.
What a doozy.
Thanks for having me. I've loved being here.
And enjoy getting back into work. Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at wedon'tknowyet.pod.
See ya.